Hello again, this is Herbert. I have a new video on kidney cancer and the surgery I had now more than 3 months ago, which is called a radical nephrectomy, in which my left kidney was removed because it had a huge tumor on it. So now over 3 months after my operation, I'm recovering really good. The pain is gone, the scars have healed. Some are visible, but they've healed. I don't take any painkillers anymore and I feel okay. My intestines are better. Had a lot of nausea in the first couple of months, but that's mostly gone. So I'm happy for that. I've been starting working therapeutically, but I've been starting. It's not easy, I get a lot of fatigue, but enjoy being among my colleagues again, and they appreciate me, so that is nice. And it's not nice to be at home all the time. Watching TV is okay. I watch a lot of great British detective series, but in the end it gets a bit boring, so I'm happy to be back at work. So for the update, the follow-up was a week ago. I had an ultrasound of my abdomen, tummy, and I had an x-ray photo of my chest, thorax, and I had the results from my urologist today, a week later. So that was a bit of tension for me. Of course, I hoped for a good result. Chances of having a recurrence after 3 months are not that big, but they happen. Look, like 5 to 10% has a recurrence even after 3 months. So I was a bit anxious for the results. I waited in a waiting room full of very old people. I was the youngest, even with my 54 years old. And I have a very nice female urologist. She's a very good doctor. She had a co-assistant with her in practice, so that was okay. So for the results, I had a positive result. There are no metastasis, no recurrence seen in the x-ray and none seen in the ultrasound of my abdomen. So I'm clean for now, and that's positive, good news. And she said the blood work you had done, my kidney function and some other kidney markers were also okay. The kidney function did decrease a little bit. It's now 65 in European standards, which is okay for one kidney. It was 77 2 months ago, a lot better, but she said, well, it can go in both ways, a little bit up, a little bit down, but count on it that it will be between 60 and 80 for the coming years. And you're a healthy person otherwise, so that'll be okay. She told me that for the next follow-up, we will have a CT scan. She didn't do that this time. She said, look, you're young, you had a lot of CT scans, PET scans before your surgery, and let's do the first one after 3 months with ultrasound and an x-ray. That's almost no radiation, because you're going to have to be researched for decades, and there's going to be a lot of CT scans, and the less we do them, the better for you, because there's always a small risk of getting intestinal cancer from that. And she said, let's be smart. So my real first CT scan after the surgery is going to be in the beginning of October. I already have the appointment, and that's a little bit better for seeing if there's recurrence. But she said, because you're a healthy, slim person, not fat, the ultrasound is very good for seeing almost everything without radiation. So that's a good compromise for me. Okay, what now? I'm gonna go ahead with going back to work and try to get to normal life, because that's hard. It's also hard mentally. Look, wounds can heal and kidney function can stabilize, but it's mentally quite hard. Like kidney cancer is kind of a death sentence on parole, because when you stay clean, no recurrence, no metastasis, it's okay, you're going to live. And if there's metastasis, recurrence, prospects are not that good. Usually the prospects are in 5 years, the 15% of people will still be alive and the most will be dead. So nobody wants to hear that because there's no real good treatments. Perhaps immunotherapy is something that's coming. I heard a lot of good stories, but that's not working for a lot of people, just for some. So best news is always no recurrence, no metastasis. I don't want to scare people, but kidney cancer is the odd one out. It's there's less options than like for prostate cancer or intestinal cancer. Those have more options. But let's stay positive. There's no recurrence, no metastasis, and I'm healthy, I'm young. And my pathology from the operation was good, although it was a very aggressive tumor. So looking forward to the next coming months. No scans, no research, no blood work, and trying to live a normal life. I hope you guys are alright, and for people that suffer from the same, good luck to you, or friends and family. Strength and health to all you, because it's not easy, it's hard. And trying to get back on your feet, living a normal life is not easy. Talk about it, get some help, get some professional help, get help from patients, from advocates. In my town there's a real good house with volunteers with all kinds of cancer. You can talk with them, you can have a cup of coffee. It helps. You can do yoga. It's okay, it's fun. I haven't been there that much, a couple of times. I intend to go there in my holidays and do some yoga, have some good talks with people to ease my mind. Okay, thanks for watching you all, and I guess the next video will be after my CT scan, which will be beginning of October, and after that I will post a new video. Thanks for watching, have a good one, bye.